I'll go back to you, Dr. Abu. When is the right time for a patient and their family to ask about ADCs? How are you sequencing it? Talk us through the timeline of when access and being on ADC is the right time for a patient.
So right now, if you think about the approved ADCs in lung cancer, they're approved in advanced lines. So we have D2DXD, we have TDXD, and then we also have Teliso-V. The three of them are approved in advanced lines. I would say that the right time to ask is probably right at the beginning to know, to kind of build like a roadmap of the treatment options that we have in case the cancer continues to grow on one treatment or another. And this way will help the clinician and the patient also, plan for the future a little bit ahead of time. So the right time to ask is always, at the beginning or whenever a progression happens. But just keep in mind that the approved treatments right now are in the advanced lines. So after progression on chemotherapy or chemo plus immunotherapy, or in some cases, targeted therapy.
Yeah, thanks for answering that. And I'll echo what you said. I think the right time is now, always at the beginning as well, too, because clinical trials, right? We're trying to
Yes.
think about moving these drugs into the front line, into patients newly diagnosed and treated. And you won't know unless you ask. So I think that's
Yeah.
important.
Yeah, I think one thing also to mention, you mentioned that, Eric, is clinical trials. There are a lot of ADCs in clinical trials. So that's why the right time to ask is always at the beginning, because there might be a clinical trial for an ADC that makes sense to be used in the first line, right? In certain scenarios, not in all scenarios. So always ask about ADCs, about clinical trials, and keep in mind that the approved ones are in advanced lines.
Perfect.